If you don't have to change your handpiece, where one handpiece will do it all for you. Again, it's that keep it simple, philosophy. You're definitely going to save time. And not only time at the front end when you're doing the procedure, but time for the assistant as well, because then you have in place a system where the staff isn't going to be uncertain about which handpiece you may be using for a given procedure. So it saves time on both ends.
The high-speed handpiece has a speed range of 500 to 200,000 RPM, both in forward and reverse. This handpiece is recommended for caries removal, gross reduction, final cavity preparation, crown and bridge preparations, margin finishing, cutting retention grooves, porcelain adjustment, occlusal adjustments, tooth sectioning, and bulk enamel reduction.
I typically will use one of two burrs. First, in cutting through the porcelain, I'll use a coarse diamond, and that just gets through that porcelain very rapidly. And then I'll go in with either probably a 330 burr, just a carbide burr, and then again, my assistants always have a series of new ones there available, especially if I'm doing extensive treatment. Sometimes I may be removing an entire arch of crowns. I'll have a whole row of these burrs in place and essentially replacing with each crown removal and get through very quickly. It's almost like cutting through butter.
The high-speed handpiece uses friction grip burrs. You may want to try the short shank burrs. Depress the push button on the back of the handpiece to engage the burr. To remove the burr, depress the push button and remove. When the handpiece is running, the back of the handpiece should never be used for cheek, tongue, or lip retraction. Any inadvertent pressing on the button while the handpiece is running will cause overheating, which could cause burns to the patient. The slow-speed handpiece attachment has a speed range of 100 RPM to 40,000 RPM. It can be used for amalgam, gold and microfill polishing, endodontics, pin placement, gross and deep caries removal, bone surgery, partial denture adjustment, cutting retention grooves, porcelain adjustment, and finishing all preparations. The slow-speed handpiece uses a latch-type burr and endo files. Again, it is placed by depressing the push button on the back of the handpiece. Insert the burr and turn it until you feel it engage, then release the button. The high torque of the Optima MX allows for speedy and effortless removal of old crowns and old amalgams. The increased tactile feedback makes finishing a crown preparation a breeze. The superior technology of the Optima MX does require a slight difference in technique. Unlike the lower torque on an air-driven handpiece, you will find that feathering is not needed when using a BN Air. This is because the BN Air maintains its RPMs when it meets resistance. The burr can remain in contact with the surface as you move through the procedure.
Well, if we're removing an old crown, they know to have for me a diamond to start with. Let's say it's a porcelain fused to gold crown. And I'm going to go in and cut through the porcelain with a narrow bullet-shaped diamond. And then I'll follow up immediately with one of the great metal cutting burrs that are out right now that have very sharp edges and cross cuts that allow you to cut through the metal without chattering. And particularly with the electric handpiece and having the torque, you're able to use those, I think, to the fullest extent where you aren't getting a chatter, but you're actually getting a very clean, definitive cut through the metal. If we were removing an older gold crown or a gold inlay, then we would eliminate the need for the diamond and just go straight into the metal cutting burr.
For the full crown burr, frankly, 3 burrs, and that's it. A coarser Fisher-like burr, that's the 850, and we also have its complement, the 8850, for the finishing aspect, and also the pear-shaped burr for cingulum reduction and lingual reduction.